Hey, it's Dr. Andy. Just checking in here to do another update here, another COVID minute. I was just having a conversation with my kids and my wife, and my oldest son said, "Oh, you should just record that and put it on, because my friends and people I know need to get this." And I think he just wants really to make sure that people understand that there really is a serious issue going on. It sounds like he feels like some of his friends don't really understand that. And so I thought, well, okay, let's go ahead and do that. So as I showed you before in episode 11, for Arizona, and I'm going to focus on Arizona because this is really perhaps the worst place in the U.S. right now, one of the top two, unfortunately. Um, and so the data dashboard from the Arizona Department of Health Services shows us kind of what's going on. Now, about a week or so ago, I showed you the epi curve that shows how many cases we're getting, and you can see how the pandemic has changed over time. And as we come down here and look at this, we see, let me move my face out of the way there. About a week ago, we were around 3,000 cases, and we were right around here, the last time I showed you, and look at this, 4,100. So increased by not quite 50%, but a lot. And as I pointed out before, these last few days, the last week or so, you expect that those numbers are going to keep going up because as new cases are reported, they show up on here on the day that the test was taken. And right now, I just heard today about 2 or 3 tests that were drawn over a week ago. That's how backed up the labs are, it looks like, because there's just so many tests coming in. And so unfortunately, we're going to see these numbers still climb because they're still reporting test results from that long ago. So these numbers are still going to go up. Have we peaked? Maybe. We don't know. We won't know for another week or two. And my guess is, since I expect these numbers are still going to go up, is that we haven't even peaked yet. So where we were hoping a week or two ago, oh, maybe, yeah, we just don't know. And it's so the counts are just, they keep going up, and that's a problem. I pointed out before that some people say, well, is it just because we're testing a lot more? Or some people could be saying, are we just testing people that aren't going to be as sick? We don't know for sure. I mean, the people that we're testing are there are more people that are younger that are coming up positive now than before. That's kind of reassuring because generally younger people will do better. However, they're still going to pass it on to other people. That's the problem. And some young people still do get sick. I just read today about a story from a 30-year-old from Scottsdale who was healthy, went out to a bar, and a few days later was in the hospital on a called a breathing tube, and I don't know the details of that, but it still happens. It still happens to young people, so it's not anything to play with. The problem, so you saw where those confirmed COVID cases were, right, and where they were claiming. If we look at hospital bed usage and availability, okay, let's look at how many beds we have left. Look at that. Smaller, getting smaller and smaller. Now they say that there's still surge capacity. This does not include the surge capacity. But ICU beds is down to 10% left in Arizona. And then the surge capacity kicks in, I guess. But we're at 10%. The big problem with that is, remember how those cases were climbing and climbing and climbing on that epi curve? The hospitalizations, they're going to follow this curve by about another week. So what we're seeing right there on June 22nd, where it's just climbing, 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 they're just starting to get to the hospital. Some of those people, you don't just immediately get sick and get to the hospital. So you expect hospitalizations to follow this by a few days, and then the real scary thing is then you expect deaths to follow that by another week or two. Okay, so what we see here, we expect to see these numbers still getting added to as those deaths are reported, and unfortunately, it's very likely that this number is going to start to go up. Like I said, we can just hope that so many of these are the young, healthy people that they won't end up on this chart. But the concern is if it spreads so broadly like it has been, then it will end up getting to people that will be on this chart.